And good evening, everyone. My name is Dr. Julia Budnik, and probably you've already worked with us or attended SDS Thursdays with us. Welcome. And if you're here for the first time, welcome as well. It'll be really lovely if you could let us know in the chat box a little bit about yourself. Where are you joining us from? Where you are in the world? And we're always interested whether it is your first Thursday or you've done SDS Thursdays before, and why you've chosen to join us tonight. Is it the topic which is of particular interest to you? Do you work with adolescents? Maybe you are parents of adolescents. Maybe you are just interested in applying CBT in different situations. So can you please let us know what is the reason why you've decided to join us tonight. And I will ask you all, please keep your microphones muted because it's going to be a big group. And if anybody's microphone is unmuted, the reception will be interrupted. So please keep your microphones muted. But if you have any questions during the presentation, feel free to put them in the chat straight away, because otherwise you might forget them by the end of it. And I will be keeping an eye on them. And at the end, we'll ask our presenters these questions. So as you know, these free events organized by SDS Seminars, and we've started them over a year ago in the very beginning of the very first lockdown, because just like you, we felt very lost, we felt very disconnected, we didn't know what to expect. And we've decided just to run some free events in the evenings for therapists and to let you know that we are here for you, and to know that you are still there and we are not in isolation, not on our own. But then these events grew. We had many guests. Andrew Beck, the president of BABCP, was one of our very first guests, probably very first guest actually, on SDS Thursdays. And he's here tonight as well to talk about the new course, which we will be starting in September. But while I am very happy to let more people join us, I want to share my screen with you and just take, because this will be the last Thursday before the summer holiday. We will break for the summer, and we know that you need a break as much as we do, because we just have that sense that we're all ready for some well-deserved rest. And we'll be breaking for the summer, and therefore I won't have a chance to let you know what is coming on in September at any other point. And we have a very packed September, and we're starting right in the beginning, very early. So I'll share my screen while people are still coming, and just let you know what is coming and what is to expect. Just one moment, let me open the right screen, which is our SDS website. And I think many of you are now very familiar with that. So yeah, okay, thumbs up. So yes, when you come to SDS website, to the front page, to the home page, what at this point in time I want you to do is to find the tab called All Courses and click on this, and that's where you do your search, where you look for courses which are of interest to you, either by the keyword of the modality you're looking for, or by the presenter, or by some other keywords within the topic. But for now, we will click on this particular tab called Calendar View, to Calendar View. And in Calendar View, you can see all our courses as they will come in calendar order. So if you look at September, we are starting very early. We are starting on the 2nd of September for a 2 half-day event. So it will be from 9 to 12 and from 9 to 12, 2 days 2nd and 3rd of September. And this event will be live from Australia with no other but Professor Tony Atwood and his colleague, Dr. Michelle Garnett. They'll be talking about autism, about behavior and emotion management for children and adolescents with autism. They specifically asked us to put it right in the beginning of an academic year, because for children with autism, this particular year we've just finished was incredibly challenging. And it would be good to have advice, because clearly the uncertainty and risks and anxiety will not go by September. So it will be very good to get some tips and advice from the world-class experts on how to deal with behavior and emotion problems in children with autism. And then very soon after, on the 9th of September, we will be welcoming our today's presenter, Dr. Jemma Hill, with the topic of managing difficult emotions and emotional regulation in adolescents. So this will be the first module of a new certificate. It's BPS approved certificate in CBT for adolescent problems. And there'll be all sorts of interesting, really interesting topical events on sex issues, on gender issues, on drug misuse, and all sorts of things which affect even social media and computer gaming, all sorts of issues which affect adolescents in today's day and age. So that will be on the 9th of September, and Paul will talk about it, and Andrew will talk about it a bit more. And then 21st, 23rd of September, we are running CBT introductory course, 3 full days with Professor Paul Grantham. And we had to open this up by popular demand because people were on waiting list for this course and couldn't wait until the later date. So if you want to start that training in CBT, that's the course for you, and it will be running 21st, 23rd of September. And then on 24th of September, another 2-hour course with Paul Grantham on working with perfectionism. This is our BPS approved certificate in common life challenges, non-diagnostic categories. And perfectionism is a very interesting and popular topic, actually equally applicable to adults and children. And so this will be run by Professor Paul Grantham. So this is our September plans. And now I'm very happy to pass the microphone to Paul, who will introduce our speakers and will talk a little more about the new certificate. Paul, just unmute yourself and go ahead.
Thanks very much, Julia. Welcome, folks. I'm sitting here this evening listening to Julia talking about the beginning of our summer recess, and I'm actually staring out at pouring rain. I don't know what it's like where you are. I just cannot believe that here we are at the beginning of July, and the weather is not really what I was hoping for and expecting. I suspect for many of you that's the case as well, but there we go. Things are what they are, and it's very good for me to develop my acceptance skills in order to actually be able to tolerate this. As Julia said, we are going to be kicking off a new certificate in September on working with adolescent problems. I'm going to let Andrew say a little bit more about that in a minute, about some of the different modules, etc., before Jemma actually then says a little bit about the whole question of emotional management. But can I just say, the way we've got this broadly planned, just so you've got, I won't go into the content of it because I'll let Andrew do that, but just so you've got some broad idea of how this is going to actually operate. These are going to run approximately once a month. They are 2 hours in length. They are designed to be occurring over, I'm going to say lunchtime, which sort of tends to imply that we've all got 2 hours of lunch, but you get the basic idea. It's to be broadly over a lunchtime period. These will actually be stretching over quite a long period of time as well. So I can't remember exactly how many modules there are in it, but it will certainly be stretching way into 2002.
20. 20 modules.
Sorry, 20 modules, sorry. And it's certainly not 2002, is it? It's actually, it will stretch into 2022. So we've got a total of 20 modules there. Basically, the choice is yours. You can either sign up for individual modules if there are particular things that grab your fancy that you want to come along to. You can purchase them in blocks. We're offering 5 modules for the price of 4, or alternatively, you can sign up for the whole thing, leading to the whole certificate that's BPS approved. The choice is basically yours, really, in terms of how you want to use that. But we've deliberately looked at providing what I hope is going to be a very varied and stimulating and interesting program in that particular certificate. And we've got a wide range of presenters who are all experienced and knowledgeable in the field, of which obviously the first one here is Dr. Hill. So just to say something briefly about Andrew and also about Jemma, for those of you that are not actually familiar with them. So Andrew's actually just moved jobs, in fact, but he's a consultant clinical psychologist and honorary senior lecturer at the University of Manchester. He has worked in the child and family field, but he's recently moved jobs. And am I right in getting this right, Andrew, that you've actually moved across the Pennines now with your work, or were you on the other side of the sorry?
At long last, I've lived in Yorkshire for 15 years, worked in Lancashire for the whole of that time, and now I'm actually getting to work in Yorkshire in Bradford. So,
right. So he's not saying this, folks, but he has actually crossed the Pennines as far as work is concerned, and he's in a new job relating to health psychology as well. Very pertinent at the moment with all the problems we've actually got. He is president of the British Association of Behavioural and Cognitive Psychotherapies, and has a particular interest as well in diversity issues as they get expressed within the therapy environment and within the work environment as well. Jemma is a senior clinical psychologist. She's got over 15 years experience of working in mental health in a variety of settings. Obviously worked extensively with children and adolescents since 2015, both within CAMS, in children's psychological services, as well as in inpatient units, where she actually set up and facilitated the provision of a DBT skills group as well. And she's currently working full-time in a newly established CAMS autism team involved in assessment and diagnosis. So I feel like I'm taking up time here unnecessarily, so I'll say no more, and just very briefly pass you over, first of all, to Andrew, who is going to say a few words about the certificate as a whole. Over to you, Andrew.
Thanks, Paul. And just once again, I want to thank SDS for pulling these Thursday evenings together. I know, it's 18 months into what's been a really isolating time for a lot of therapists, and I think being together as part of this community is just an absolutely lovely thing for you to have facilitated. And one of the things I really enjoy about it is the chat function at the side, and it's because part of that getting together when we go to training or events is often the talking that we do over coffee, over tea, and just catching up and hearing what people are doing and what their interests are. And I really like the fact that people at SDS Thursdays really use the chat, and it's kind of part of that kind of social contact with our peers that I think has been missing for a lot of us this year. So thanks for that. I'm going to just talk a little bit about the course. So as Julia said, there are 20 modules that'll be over probably 18 to 24 months they'll be running for. And it came about because when the SDS team and myself were running the certificate in CBT, working with children and adolescents, we were really aware that lots of people were coming along very interested, passionate about this topic, but there were particular gaps in what they wanted to find out about and what they were interested in that didn't necessarily fit in to the whole day workshop based approach that STS and most other training organizations traditionally sort of use as a format. And these topics were kind of bite-sized topics, effectively, the kind of thing that we thought practitioners would really benefit from getting together with someone who's an expert in the field for a couple of hours, who could do two things, and I think both of which are equally important. One is to present you with some ideas and some models, some of the current theory and practice, so that people could feel that they had a good grasp of what was important in that particular topic area. But I think equally usefully for practitioners to have a skillful and facilitative approach to getting you to think about these dilemmas together. Because I think if there's one thing you can say with a degree of certainty about adolescence, is that it's a constantly shifting field. So the kind of the psychology and the biology of adolescence is constantly shifting and changing, but actually the social context within which that's taking place is constantly changing as well. And so I think it's really important to get on top of current theory, but then you've got to think about what that means at this minute to you as a practitioner. And an example of that might be the kind of ideas that we might have presented 2 years ago around a topic like managing emotional distress, which we're going to hear about in a moment from Jemma, will take different consideration when you're thinking about how you do that work during a pandemic. And what are the kind of environmental factors that are driving that now that might have been different to what had been driving it a couple of years ago. So I think this potential to sit and think about these things together is one of the real strengths of the time that we're going to have on this course. So I think that's my reason why I think it's going to be genuinely useful. It's not just the expertise of the presenters, it's the reflective time. And I'm really pleased that the first presenter is Jemma, whose work I've known for a long time and who's a really outstanding clinical psychologist, someone who I think is absolutely rigorous in her application of theory to practice. So she's got that real strength as a practitioner. That's a really rare thing, but also brings those ideas to life and has got a very child-centered, young person-centered view of provision of services that I think will really really appeal to people who come along to the course. So I'm not going to say any more. I'm going to hand over to Jemma now, but I'm very much looking forward to seeing some of you, I hope, on those courses, either the ones that I'm going to facilitate or the ones that I'm hoping to attend, because there's some really high quality stuff and I certainly need to refresh my practice. So I'm really looking forward to seeing you and seeing the presenters then. So thanks, Paul, and thanks everybody for coming along this evening.
Thanks very much, Andrew. Over to you, Jemma, if you want to share your screen.
I will do. Now, bear with me. Me and technology don't always go too well. So I think, let me know if you can see this. I'm just going to put it on a slideshow. Can you see that? Is that better?
Yeah, we're good. We're good.
Okay. So I wasn't really sure who would be coming today, so I've tried to pitch it at sort of a level for everybody, really an accessible level that people can sort of relate to. So like I said, we're going to be talking about managing difficult emotions in adolescence. So just to get started, I just wanted to sort of do an exercise, and this isn't something people have got to comment on out loud, but if people could just have a think about how many of you have been on a telephone call, for example, with a company and felt so annoyed that you wanted to screen down the phone or put the phone down. Okay, often happens to me. How many of you have felt so anxious and scared about something that you've wanted to avoid it completely? Or how many of you have maybe felt so ashamed about something and you wanted to hide from it? Or how many of you have felt really guilty about an action and wanted to repair what you've done? I'm hoping that most of you are going to say that you've experienced at least one of these emotions at one point in time, probably not all of them. And I guess what I'm showing here is that this experiencing a wide range of emotions is part of the human condition. It's what makes us human, to experiencing all these different emotions. Okay, I'd now like you to think about, and again, it's not something you have to say, but just to have a think about, just take a minute to think about your relationship with emotions and how you might have acted in some of these situations. So for example, are you someone that maybe feels emotions really intensely and that you will react? So with the telephone call example, are you someone that would shout and gain range at the person down the phone and put the phone down? Or are you maybe someone who's a bit more emotion phobic and you actively go out of your way to avoid emotions or thoughts or situations that might evoke sort of strong feelings? Or maybe you're someone that's a bit more numb to emotions and the experiences that are around them. So I just want you to think about that, because and just hold that in mind when we're going through and we're talking about emotional regulation and what it is. Okay, so what is emotional regulation? So there's quite a few different definitions about emotional regulation out there, but I particularly really like this definition that was done in 2004. So there's a few parts of this that I just want to touch on and why I particularly like it. So according to this definition, somebody that's got skills in emotional regulation, the first skill they have is they have awareness and acceptance of their emotions. Okay, so they're aware of what they're feeling, and they're able to accept that emotions are part of the normal human experience. And I'll come back onto that later about acceptance, but they're aware of what they're feeling, which is a really important part of emotion regulation that I think often sometimes people forget. They might jump straight to oh, we need to use strategies to regulate this emotion or bring it down or up. But they actually don't think about the fact that we actually need to make sure, first of all, the first stage in managing anything is making sure we're aware of it and we understand it. So I've worked with people over the years that have varying degrees of what in psychological terms we would call emotional literacy. So how well they're aware, how well they understand their emotions, aware of them, and can communicate them. So somebody that, like I say, is skilled in emotional regulation will have good awareness of their emotions. They'll then be able to control their impulsive behaviours and urges, even in the face of experiencing negative emotions. Okay, so what I really like about this bit is that it also acknowledges the importance of urges, because we know that urges precede a behaviour. So often in DBT, which Paul mentioned that I'm trained in, I've set up groups, we always sort of work with the urges that people experience in rather than just the behaviours, as we know they're really important. If we can get change the way someone reacts and responds to an urge, we can change what they might do as a result of that emotion. So their ability to control their behaviours and urges, even when they're overwhelmed by certain emotions. And then the ability to flexibly use regulation strategies, so strategies to manage emotions to meet their goals and the demands of the environment. So what I'd really sort of draw your attention here to is the word flexibility. And I'm going to be talking a little bit more of that later, but there's a psychological term that's recently sort of come into its own with acceptance and commitment therapy, and there's a term called psychological flexibility that's well regarded in the literature and the evidence now that people that are higher in psychological flexibility do generally much better in life. There's much better outcomes associated and less sort of difficulties. So if someone's high in psychological flexibility, they're able to choose how they respond to these emotions, choose whether they react or respond to meet the outcomes they want to do and to get where they want to in life. So, and I guess the pictures at the bottom here, what I'm just showing with this is that I guess I want to highlight that emotional regulation and your ability to manage emotions is a developmental book. So it happens as a developmental strategy. As we get older, we usually become better at managing our emotions and have more control, self-control over them. So it starts from when we're a baby, and then you can become like a leader and be able to manage your emotions. So it's a developmental task. So with that in mind, I guess we're going to think about adolescence in particular, and adolescence and emotions. So I've said here storm and stress because there's a guy called Stanley Hall that was the first person to coin the term adolescence, and he defined the adolescent period, so it's the period before adulthood, and he defined it as a period of storm and stress. So what he meant by that is sort of this stereotyped image that we get of adolescents and teenagers is that they have emotions all over the place. They're all over the place. They can't manage them. And he sort of really focused on these sort of hormonal changes and environmental stresses that teenagers had to go through. And while a lot of stuff that he said, and that is sort of recognised now as sort of quite stereotypes that I was saying about hormones and emotions all over the place. There was a lot of really influential things that he picked up on as well, and some of which have been confirmed by research since. So, for example, we know that during adolescence, there's substantial and protracted brain changes that go on for an adolescent. So much so that I've seen it in the literature termed as the adolescent brain is closed for renovation, because there's so much neural sort of changes that's happening for adolescents in this period. So one of the things, for example, we know with the adolescent brain is that the part of the brain that is involved in feeling rewards, and the reward system is a lot more hypersensitive. So they're more likely to feel rewards from taking risks and doing more risky behaviours. Alongside that, we know that the part of the brain in adolescence that is responsible for inhibition and decision making and problem solving is less developed. So coupled, there's a bit of a toxic sort of effect there. So we've got an underregulated, what we call the prefrontal cortex, that is involved in sort of inhibiting sort of problematic behaviours and making good decisions. And then we've got a part of the brain that's more sensitive to reward. So that has real implications for things like risk taking in adolescence, which is sort of associated with emotions. So it's just keeping that in mind really when we're thinking about this sort of vulnerable age. We also know that adolescents, like sort of Hall said, there's a lot of normative social stressors that affect this population and their emotional states. And now Andrew just sort of mentioned COVID, and that's something to think about, because we know that they've been, you know, adversely affected by this. But also things like, you know, academic demands are at their highest, probably than they've ever been. Lots of competition in terms of leisure and social activities, and also the demand on them to form relationships with their peers. And we know about the influence, like Julia said before, of social media and the impact of that's going to have as a stress as an adolescent. We also know that it's a time, the research suggests, of increased emotional reactivity, so they're more likely to feel quite emotional, and that there's decreased support with them for the environment for that emotional regulation. So in essence, I guess I'll sum that up, and Sarah Jane Blakemore, Professor Blakemore, one of the neurologists that's written a really good book actually on the teenage brain and what happens, actually defines it as a period of vulnerability. So just to keep that in mind. I think Olivia Rodrigo actually said as well, she's not as influential as Sarah Jane Blakemore, maybe more. She calls it she said it's brutal out there, which I guess sums up that period. Okay, so emotional regulation. Why do we bother with emotional regulation? Why am I here today talking to you about it? So we know that difficulties with regulating and managing our emotions is associated, or the literature tells us, is associated with many adverse outcomes. So it's got many problems associated with it. And this is as true for people that have high emotional reactivity and react impulsively or problematically to emotions, as well as those that don't actively avoid emotion, which is in a term that we call experiential avoidance. And a lot of you are probably familiar with that term. So that's when we avoid emotions that we're feeling, we take active steps to avoid them, and we're uncomfortable with sitting with emotions or thoughts that might cause us difficulties. So we know that adverse outcomes are associated with both, such as, you know, if someone's high in emotional reactivity, we often see that they have problems in relationships with the adults in their lives, with parents, with all sorts of relationships, and they do a lot of problematic behaviours. We also know that there's increasing vulnerability to mental health difficulties for people that have difficulties with emotional dysregulation. So the literature is quite clear on that. At one point it was a bit of a chicken and egg situation. Is it mental health difficulties that cause emotional dysregulation or contribute, or is it the other way around? But there's some research paper in the adolescent literature that says that actually it's very much linked to psychopathology later on. So emotional dysregulation is linked to outcomes in later life. And we also know, as practitioners within mental health services, for those of us that work in mental health services, that a lot of the behaviours that we see that people come into contact with mental health services are usually as a result of some form of emotional dysregulation or some difficulty with emotion, usually attempts to obtain relief from or reduce intensity of an unpleasant emotion, or as a result of one. So for example, I've just put a few examples there, but suicidality and self-harm would be, a really sort of relevant example of that. So often, there's lots of different functions of both suicidality and self-harm, but one function of those is to often escape from emotional pain that people might be experiencing. So it's a really important sort of thing to work with, and it's a lot of what we see in mental health services, an important factor to work with emotional dysregulation. So working with emotions. So I guess what I want to say here, a topic that's quite close to my heart, and I guess that's probably because I'm trained in DBT, but I think this applies across all therapeutic modalities and all work with anyone really, is when we're working with emotions, the first thing that I would say before we get to any sort of talks about helping someone to kind of manage their emotions or telling them what they need to do, we need to do something called emotional validation. So in DBT, this is something that's very sort of, it's emphasized a lot. So what do I mean by validate? So when I'm talking about validating someone's emotion or someone's experience, I don't mean agreeing or approving with what somebody has done. I mean, it's conveying the belief that somebody's feelings or their beliefs are real, logical, and understandable. Okay, so in terms of working with them, what we'd want to do is, Linehan calls it in one of her books, searching for the nugget of truth before the problematic part of it. So I really take this into account in my practice, and especially when working sort of in adolescent inpatient units with really emotionally high dysregulated teenagers. So before I even get to the point of trying to look at what the problem is, it's let's validate what it is that they're feeling at this time, because there's always a truth in the emotion that somebody's feeling. So it's finding that truth, and it's validating and showing that you understand it. Because if not, the therapeutic alliance will be ruptured and they won't even want to do any work with you, which I've seen time and time again across different settings. So the next part of that is obtaining an invitation to treat and offer change. So relatedly, before we start to, I'm just thinking, for example, of when, you work in services and you might get, when I used to work with quite young children, and you get parents that would come in and say, he needs to manage his anger better. He needs to stop getting so angry. And again, if we started out as therapists, sort of meeting people and telling them what they needed to do, or we think this is the problem, you need to learn how to manage your anger better, or you need to learn how to manage that sadness better, we're not going to get anywhere with people. And it's a bit of a topical thing here, but I guess what the literature says is, if sometimes you're in therapy with people and you feel that you're at a bit of a tug of war, the chances are you've not validated the emotion enough. You've gone straight to the change strategies. And you've not sat with them enough and found the truth in what they're feeling, why they're feeling it, and validated it. And like I said, I've seen that a lot in the settings that I've worked with, and people say, I don't get it, they're not motivated to work, they don't want to work. And usually you can put it back to the fact that actually they feel really invalidated, and we've not looked for the invitation to treat and offer change. We've gone straight to the problematic part of changing the emotion rather than sitting with it for a while. So I've just got a couple of examples here that I just wanted to share with people. I think we've got time for me to just sort of go through these. So these are just a couple that I've put together, probably based loosely on my experiences of inpatient working. So the example one, again, I'm not going to offer people to offer feedback at this stage, but at the end, and there's going to be, time people put in the chat or people to chat about it at the end. But in this example, we've got a teen that's shouting, they're really angry, they're shouting expletives, they're annoyed, they didn't get leave that they'd hoped for from the psychiatrist. So a very, very well-meaning therapist or nurse or somebody that's working with the young person says, you didn't get leave, was it because of the incident last week? Teen said, yeah, it's not fair. And then they respond, I know, it's not fair. They take actions from last week into consideration though. And maybe the psychiatrist, didn't realise how much you wanted to see your sister. What would you usually do when you feel like this to help you feel less angry? Okay. The teen, as you can see here, doesn't really respond very well to that. She doesn't really respond, and then she says she's going to kick off in here tonight. Okay, and then the therapist responds, or the nurse responds by saying, well, yeah, I know you're angry, but actually doing that's going to make it worse. Perhaps we can have a look through some strategies that can help you take your mind off it. Okay, so I want you to keep that in mind. I'm not saying there's anything wrong. This is a very well-meaning therapist. They're very well-meaning in what they do. And some of you might look at that and say, well, that seems fine to me. But now I'm going to show you a different example. Okay, so the same example, the teen's very angry, sort of saying a bit off with your expletives. The therapist says it didn't go as well as you'd expected. Didn't go as you'd expected. The teen says no. He said he could have leave if I engaged, but now he's changed his mind. What an a-hole. So the therapist then explores that a little bit more. So was it this weekend you wanted to go to see your sister? No wonder you're feeling angry. I get angry too when I'm blocked to do something that I want to do. It also sounds like you thought you'd done enough, but he thought differently. That must have been confusing. Okay, the teen then responds in a slightly different way. She's a bit more engaged with the therapist. Yeah, I don't get it, but she still comes up with the consequence of, I'm going to go off in here tonight. So then the therapist goes into things a little bit more. So the therapist sort of acknowledges that and says, to show them how angry you are. And yeah, that would be one way of letting them know. But I'm wondering if doing that might mean you don't get to see your sister next time either, though. And it's going to cause a whole host of other problems for you. Maybe instead, if we work out how to communicate how angry and disappointed you are in a way that's not going to cause extra hassle for you, explain how confused you felt about what you were expected to do. The teen thinks about it and says, no, it's no point, they won't listen. And the therapist says, maybe not. But it might not make, yeah, you're right, it might not make a difference. But at the same time, it might, and it seems important to try. I can help you. Okay. So this is the sort of things I'll be talking a little bit more about in my training. But I guess sort of the things that I wanted to highlight here for people that might not have picked those up, very subtle things that have been done in the second example rather than the first. And I guess I'd probably ask you to think about, if you were the teenager, who would you feel most likely to want to work with? Would you feel quite empowered and want to change as a result if you were the first one? Or would you actually feel a little bit invalidated, feel like it's been put on you, so have a look. So I guess what I've done there is in the second one, in the second example, just a few things to point out that what I did in the second one, I validated what was lost for this young person. So the visit to the sister. I normalized emotions and I taught them about situations when emotions arise. So I taught her about the emotion anger and what arises with anger, which is when your trigger is often when you feel blocked. I also validated the distress. She was feeling confused, she was feeling angry. And then I introduced the idea that although her emotion is really valid, I'd feel confused and angry as well in that situation. Responding to it at that level might not reach, this is important, the outcomes that she would like. So it's actually going to cost her more by responding in that way. And then I offered her an alternative, or he. Then I validated the worry that a change might not work, which is a really valid point. And then importantly, I sought the invitation to treat. So remember when I said before about invitation to treat, it's not, if I'd gone at that in a different way and said, you need to stop being less angry. If you start acting like that, this is not going to get you anywhere. I actually sought the invitation to treat from her, from what they were experiencing. And then I let her lead the way. So I actually said, I can help you, to the point that she was the one leading the way. Okay, so just to think about slight differences in that, in how I approached that work with her. So just to finish off in terms of the training in September, I guess I'll be focusing more on skills and strategies, which I've not gone into a lot of detail in this talk, but I'm going to talk about how we help people to identify their emotions, manage their urges and behaviours, and I'm going to be drawing most on models of dialectical behaviour therapy and more third wave sort of models like acceptance and commitment therapy, that have both themes between them, have themes of mindfulness and acceptance, with the idea of increasing flexibility and behaviour change. So increasing people's flexibility in how they respond to their emotions, giving them those choices. And I just kind of wanted to sum up here what I guess the message of some of that intervention work would be with these sort of young people, or anyone I was doing with this work with, really, is helping people to experience emotions as uninvited guests or phenomena, that's how I like to think of them, that are actually really useful and can tell us a lot, and that we can learn to skillfully work with them and have them around rather than having to try and avoid them or control them. So, and I've got some really nice sort of metaphors and videos that we can share with young people to get some of those ideas across. And then I also want to work with, I just want to also mention in the September training around the environment and system around the adolescent, because I sort of very quite passionate about the fact that it's not all the onus is on them, it's how we can support the system to help them manage these emotions as well. So yeah, that's it. That's all I've got to talk to you about today. So hopefully that's a helpful introduction.
Thank you very much, Jemma. We already have comments here from people. Lisa, for example, says that was a really clear example of showing the importance of validation. And it was indeed. And Amy sort of echoing it, saying, I can already see where I go wrong sometimes as a SEN teacher. Thank you. And we have a couple of questions. So if you don't mind, Francis is asking, can you give some more examples of invitation to treat?
Yeah, sorry, I'm just reading through the, oh, there's some nice messages, isn't there? So can you give some examples of invitation to treat? So I guess what I really mean there is often it's a natural, I find it's quite a natural, it should be natural where that comes in, where you're working with someone and it's where they're talking or where you start to notice. I mean, as a therapist, you usually start to pick up quite quickly where you're doing your formulation and you're starting to notice where people's problems are, or things that might be getting them into trouble, if you like, or not sort of helping them to meet the outcomes that they want to meet. So I guess some more examples of that invitation to treat, it's to how it basically means, how do you get in there, and rather than telling someone they need to change, it's how do you offer that invitation to try and make things different. So I guess different examples of that would be sort of saying to someone, I guess you could ask someone what they think, you know, what would you like to be different, you know, has any of these ways of reacting or that caused you difficulties in the past? You know, have you noticed that sometimes there might be some consequences of you acting this way? So I guess that's what I've done recently with a young person. I've looked at some of the unintended consequences of them maybe doing some of the things. So I usually validate there's some real advantages to some of these things that you do and that you have, but I guess there's some really disadvantages of them as well, possibly. You know, it sounds like that, you know, it can get you into trouble or it can do this. So I'd sort of probably do it that way, let them sort of think about what the consequences are and where they might go wrong, and then you could naturally go in there and just say, I wonder if that's something that you might want to work on, or I wonder if that's something that we could help you with. I wonder if it's something that we might be able to think of some strategies together to think of some ways that when that feeling shows up for you, that really overwhelming feeling, we can work with that in a way that's probably going to help you more than what you're doing at the moment. Hopefully that's answered that question. Oh.
I hope so. Thank you. Amy is asking a question, but because it's in the chat, I will read it out. I have a question for you, Dr. Hill. I have a young woman in my class who has ASD. She sometimes becomes distressed, and I can't figure out what the trigger is. She's verbal, but often I feel she's overwhelmed by me asking, are you okay? What's wrong? Could you give me a strategy that I could use that would be beneficial to her?
Okay. I actually work, I don't know if you were here at the starting, but I actually work with young people with ASD at the moment and autism. And I guess just to say, you know, that we know that people with autism are already people that might be more vulnerable to high emotional reactivity or emotional dysregulation. So just to keep kind of that in mind. And also there's some often less able to articulate what it is that they're feeling and communicate those emotions, even if they're very articulate in other areas. It might be that their emotional literacy, as I mentioned before, is quite poor and quite different. And I know in our assessments of people with autism, that's often one of the things that we look at. We look at what's their understanding of emotions, how they describe them. So that's just to keep in mind. I'm wondering if it might be helpful thinking, have you heard of something called the star diagram? Have people heard of the star diagram? That's often used with people that present with I guess you could call them sort of behaviours that challenge the system potentially. So it's just a way of figuring out for somebody what might be going on for them, patterns in their behaviour that we can then make a difference with. So the star diagram, I can try and find a link to put in the chat afterwards, but it's really something, I guess, for you as staff that you might want to do. It's not to involve necessarily the young person, it's for you to do as staff to work out. So it's STAR, the S stands for, I remember this now, setting, the T stands for trigger, A stands for act, I think, what the person did, and then the R stands for what was the response. So if you, as staff, if you kind of figure that out, you look, so try and keep a record, fill in a star diagram every time, or star template every time that that she acts in that way, and over time you'll be able to see patterns. So what you're looking for there is the setting. Are there particular behaviours? This behaviour is more likely to occur at particular times. What lessons are going on for her at that time? Is there particular environmental demands on her, or particular things in the environment that might be hard for her? The trigger, what was happening before she became distressed, directly before, and then you've got the act. So what did she actually do? What was the behavior? And then the response is, how did people respond? How did staff respond? How did she respond? And like I say, what we're actually doing then is we're going to collate all of that information that you've got to then look at, well, what could we make a difference with there for that? If we can work out patterns, we can then look at what we can do. So could we change the setting, for example? Is there anything we can change in the setting that might reduce her likelihood to become distressed? Is there anything that we could do to reduce those triggers for her that might be making her feel quite distressed? Is there anything that we can do to help her manage that behaviour better? And is there anything as a system that might be reinforcing or maintaining that behaviour that we're explicitly doing that might be actually keeping that behaviour going? So I guess it gives you, by doing that, it gives you really sort of clear options to try and figure out exactly what might be going on before you sort of jump in with particular interventions. Hopefully that's helpful. Like, it's not something to do with her, like I say, but as a staff team, it might be something that you want to do, that you can do together in a cap. Okay.
Thank you very much. We have some very useful comments and some other questions in the chat, but I'm very aware of the time. We're usually finishing at this time. What I wanted to say is that we now practice staying behind a little bit after the talk. So if you want to continue, pick up on some particular questions, you can stay behind and just chat to the presenter. But otherwise, I am happy to close and to say we're meeting again on the 2nd of September. So the same day as we have Tony Atwood and Michelle Garnett, in the evening we have Paul Grantham on presenting his course on perfectionism, which he will be teaching later on in September. So put it in your diaries, 2nd of September. We hope to see you all here. And thank you very much for coming. And have a lovely summer. I hope the weather will improve and we will all have good, well-deserved rest. Thank you very much, Jemma and Andrew. Jemma, lots of lovely comments about your talk. Everybody says how useful it was, and Richard even says, hallelujah, finally somebody recognizes emotions and not just thoughts. So thank you very, very much.
Really
and
pleased.
you can unmute yourself, guys, and say goodbye. And thank you. And it's always a very nice moment when we can see your faces and see your waving hands. Bye now.
Bye.
Bye. Bye. Take care.
Bye-bye.
Bye.
Thanks so much.
Bye.
Bye.
Thanks very much.
Bye, everyone.
Bye-bye.